Good morning. Welcome back to OpenMed School. In the last session, we have discussed about the observational descriptive study. And today I'll be discussing about observational analytical study, which are classified into case control and cohort studies, and also cross-sectional analytical studies. So today's discussion is on case control and cohort studies. They are analytical studies. They are important designs used to study exposure-disease relationship and for calculating odds ratio in case control studies and relative risk in cohort studies. So what's the concept of case control study? Here the participants are selected based on the disease status. So disease has occurred and you are checking the exposure. So you can say that this is a retrospective type of study. So there are two groups. The cases and other without disease or the controls, and past exposure is assessed. As mentioned, the direction is inquiry is backwards, so you can say it is a retrospective study. What are the steps in case control study? You have to identify the cases, that is the persons with the disease, and select comparable controls. Hope this point is clear. That is why it is mentioned a retrospective study and is more useful for rare cases. So from the case or the disease, you assess the previous exposure and compare the exposure between two groups. So there will be a comparison group as the controls. So the basic design of case control study, first is you have to identify the population. The cases are the disease and the controls are the persons without disease, and you look backwards. Hope it is clear why it is called a retrospective study. Classic example is the Dole and Hill BMJ 1950 smoking and lung cancer study. So here compared lung cancer patients with the controls and found that there is a strong association between smoking and lung cancer. So case control data presentation is using 2x2 table. This will be discussed in detail in another session. So compares exposure among cases and controls, and you calculate the odds ratio. So remember, case control study use the odds ratio. It's a simple and widely used format. So here use a 2x2 table. The cases are here is shown the cases in the exposed group the cases are A, and in the controls it is C. The exposure absent group cases are B, and in the control group the D. And in the 2x2 table we calculate the odds ratio by cross multiplying and dividing. That is AD divided by BC is the odds ratio. So it measures the association. Odds ratio is used in case control studies. As mentioned, odds ratio is AD by BC. Odds ratio more than 1 suggests a risk factor, less than 1 suggests protective factor. So smoking versus lung cancer, in the smokers group 90 had, and non-smokers it is 10. In controls, the smokers 40 and non-smokers were 60. So once it is tabulated, smokers with lung cancer 90, no lung cancer 40. In non-smokers, lung cancer 10, no cancer 60. So odds ratio will be, you are cross multiplying 90 into 60 divided by 40 to 10. Hope it is clear to you. So its advantage of case control study is an efficient for rare disease. Remember, case control study is used for rare diseases. Relatively quick, inexpensive, requires smaller sample size. Can study multiple exposures in the same study. Limitations: there is a recall bias and selection bias. About bias we will discuss detail in another session. Again, remember, case control study cannot measure incidence. Temporal relationship sometimes is unclear. So now we go to the cohort study. The concept is participants are selected based on an exposure. There are two groups, the exposed group and non-exposed group. They are followed over a time. So the direction is forwards. So cohort study design, the population is identified. They are classified into groups. Those who are exposed, or the grouping is depending upon the exposure status, exposed and non-exposed. Follow up over a period of time and you record the occurrence of the disease. So types of cohort study, there are different types. The prospective cohort study, we can have retrospective cohort also, and ambispective, that is both prospective and cohort are present. So depending upon the data, you select the type. Classic example is the Birmingham's heart study. It's a long-term cardiovascular cohort study. Smoking, blood pressure and cholesterol risk, and the cardiovascular endpoints. It is a major landmark epidemiological study. Again, the data is presented as 2x2 table. The compare disease occurrence between exposed and non-exposed. And here you calculate the relative risk. So remember, in cohort, easy to remember, cohort, there is R is there, cohort, it is relative risk. So here again you make the 2x2 table, exposed and non-exposed, disease, no disease, just like the case control study. Here the difference is that you are calculating relative risk. So relative risk is used in cohort studies. You compare, the interpretation is same, relative risk more than one indicates increased risk, less than one indicates protective exposure. So example calculation, smokers with the disease 80, non-smokers with the disease 20. So how will you calculate? So relative risk is calculated by the formula A divided by A plus B divided by C divided by C plus B. So here you can see the calculations of the smokers total 80 who had disease, and non-smokers without disease is 920. So total 1000. So first you calculate A divided by A plus B. So that is the disease divided by total non-smokers. Then you go for the incidence in non-smokers. So total 20 had disease, 980 had no disease. So total non-smokers were 1000. So the value is again 20 divided by 1000. So the RR is, or relative risk, is calculated by dividing these two, that is 0.08 divided by 0.02. Hope you understood how it is to be calculated. Again, I will explain a little more detail when you are discussing 2x2 table. What is the advantage of cohort study? It is a clear temporal relationship can be identified. Incidence can be calculated. I have already told that in case control you cannot calculate the incidence. Can again study multiple outcomes. This is good for rare exposures. Whereas the case control study is for rare diseases. So limitations, it is expensive, time consuming, there can be attrition, loss of follow-up. Large sample size is often required. It is not efficient for rare diseases. It is again, remember, rare diseases you go by the case control study. So case control, if you compare, case control is a selection by disease. For example, carcinoma, lung. These are the selection cases. Cohort study, selection by exposure, that is smoking, non-smoking. You divide into two groups depending upon the type of exposure. Again, case control, use the odds ratio. Many times it is intermixed. So cohort study, ideally you should use relative risk. So key message, case control studies estimate odds, cohort studies estimate risk. Both are important in epidemiology. Proper design improves the validity of the study. Stay tuned for further videos on epidemiology. Thank you.